Welcome to H Series, a podcast where we discuss everything healthcare. I thank you for subscribing to my channel, and if this is your first time, kindly click the subscribe button below so you can be notified when I upload new interesting episodes. I remain your host, Sunday Clement. Today we are going to be discussing the topic ethical issues in healthcare leadership. By way of introduction, ethical issues in healthcare leadership can arise in many forms, and addressing these issues is critical to maintaining patient trust and ensuring the provision of quality care. Here are some examples of ethical issues in healthcare leadership. 1. Conflict of interest. Healthcare leaders may face conflict of interest that can influence their decision-making. For example, a leader may have a financial interest in a particular treatment or service that may not be in the best interest of patients. 2. Patient confidentiality. Healthcare leaders must ensure that patient confidentiality is maintained at all times. This can be challenging when making decisions that affect patient care or when dealing with sensitive information. 3. Resource allocation. Healthcare leaders must make difficult decisions about the allocation of resources, such as staff, equipment, and medication. These decisions can have ethical implications when resources are scarce, and patients' needs must be prioritized. 4. Informed consent. Healthcare leaders must ensure that patients have all the information they need to make informed decisions about their care. This can be challenging when patients have limited health literacy or when there are language or cultural barriers. 5. End-of-life care. Healthcare leaders must navigate ethical issues related to end-of-life care, including decisions about withholding or withdrawing life-sustaining treatment, managing pain and suffering, and respecting patients' wishes. In conclusion, to address these ethical issues, healthcare leaders can establish policies and procedures that prioritize patient-centered care, transparency, and ethical decision-making. Leaders can also provide education and training to staff about ethical principles and best practices. Finally, leaders must lead by example, demonstrating ethical behavior and promoting a culture of integrity and respect. That is all the time we have for today's podcast. For questions and inquiries, feel free to reach me via email displayed on the screen. I will be more than happy to respond to all your questions. Also be reminded to support the channel by clicking the subscribe button below. Thanks for tuning in, and be sure to join us next time as we continue to explore other critical healthcare topics of importance. Until then, I remain your host, Sunday Clement. Wishing you all the best in your healthcare journey.